Yeah, well, I think first of all, it's important to note I would have been dead if they hadn't taken me out in the hospital because I had a collapsed lung, right?
Yeah.
So I'm alive now because of the healthcare system.
What's up, everybody? Welcome back to the channel. I'm Joseph. I'm here again with John. You may remember him from a previous video.
What's up, guys?
So we're just going to do a little update on John. He's actually had some medical situations going on, so came back, visited him. We're going to talk a little bit about that. So to start out, how long have you been in the hospital recently?
Well, I just got out after being in there for 3 weeks, but I've been in and out of the hospital for about 2.5 months. 3 months, actually.
Okay, do you want to just kind of briefly say, why?
Okay, yeah, so basically I've got a chronic liver disease that I've had for a long time. It was diagnosed 5 years ago. And basically due to complications with that, I had a collapsed lung. They got filled up with fluid. I didn't know it. I thought I was kind of just had a infection or whatever and a cough. But then when I went into the doctor, he sent me to the emergency room, and then that started the whole process. They had to put a hole in my lung, drain a bunch of fluid out, and then spent the past 2.5 months in the hospital.
And they initially had no idea what was going on?
No. Well, even though I told them I had that chronic liver problem, which apparently this issue is a symptom of that chronic liver problem, it's a very rare symptom, especially on the side I had it, so they looked for a bunch of other things. They thought it was caused by a bunch of other stuff before that.
Okay. And so the whole time, we're going to kind of try to gear this towards German healthcare system in general, because I feel like this is a pretty good insight for you into the German healthcare. So the whole time you were in there, did you pay anything? Or what did you pay the whole time you were in there?
Yeah, I mean, it's not completely free. So for each day you're in the hospital, well, first of all, it depends on whether or not you're on sort of the public healthcare option or a private healthcare option. So I'm on public healthcare. I don't know how private healthcare works, right? So it's probably different in terms of how much you pay per day and for operations and procedures they do, medications and all that stuff.
So by public, do you mean you go through your company and your company pays for it, or?
No, so the government provides a public healthcare option for everyone in Germany that you're required to have healthcare. You have to have a healthcare option, and the public option is available for everyone. So you can, if you want, say you're a healthy individual and you're young, it's probably going to be cheaper for you to go private healthcare, and you'll also get other benefits, like doctors will be able to squeeze you in for appointments earlier and stuff like that. And they'll probably offer you extra procedures, or if you go to a hospital, maybe you'll get remote control, like a TV or something. You know what I'm saying? You can buy extra features with your private insurance.
So you right now, do you pay anything for the public?
Yeah, I mean, it's taken out of your salary. Everyone pays for it.
So because I was looking online and I saw some numbers that was maybe this was for your employer paying for it. So they would pay 15% of your salary towards it or something like that? What's the situation?
I don't know how much they pay, honestly. I just know they match. You have to pay, and then they have to pay an amount. And it's pretty significant, I think.
Okay. So is your employer matching towards the public, or are you just paying all the public by yourself?
No, they match. I don't know if it's the same amount, but they have to pay, and you have to pay.
Okay.
So it's split up, whatever the ratio is, I don't know.
Okay, so this is something I've read about Germany, is that, because while I was looking at some things, and your life expectancy in Germany is a little bit higher than the United States.
Yeah.
But do you think that is due to, because a lot of people praise healthcare systems, when you're in the United States, a lot of politicians will praise healthcare systems in other areas. In Germany, they'll bring up Germany. Germany was a big, one of the talking points for President Obama, actually. Yeah. For getting universal healthcare. But do you think that is comparing apples and oranges in a way, because the German population maybe doesn't have a lot of the same issues and problems that the United States has, such as bad eating habits, specifically where we come from in the South, diabetes, obesity, things like that. Are those things on the same level that could be contributing factors to something like a, or do you think, or would you attribute the healthcare system to the higher life expectation?
No, I don't know. I think life expectancy, if you were looking at the health care system specifically, is probably not the metric you'd want to look at. because you want to look at things like morbidity or time from admission or recognition of a disease to like death, years lost due to that. So I would think there's too many factors in terms of life expectancy, to be a relevant comparison.
Yeah, I would agree too. That's what I was thinking.
Yeah.
But it's one of those numbers somebody might use to be like, oh, this one's very number. Okay, now this is a serious number that is, okay.
Okay.
So I was looking, and the United States cost of healthcare per GDP is around 17.9%. And Germany's is 11.4% of their GDP. So it's significantly less cost. And Germans are paying about half of what Americans are paying per capita.
Yeah.
So what are some of the contributing factors to why the German healthcare system is so much cheaper in those regards, at least, to the United States?
God, honestly, I have no idea.
Well, because you and me both, we were just watching something on this yesterday, that typically, if you pay less for a product, you're going to get less quality of that product. So what is it? Is it that Germans have found a way to reduce some of the other expenses, like administrative costs? Because I was looking in the United States, almost a third of our healthcare expense is administrative costs, which is astronomical and ridiculous.
Yeah.
Drug costs being super expensive. Do you think it's more Germans have found a way to decrease those costs, the cost of things that don't affect quality? Or do you think it's a matter of, maybe the quality's not quite there, but it's cheaper and more affordable for everybody?
Okay, yeah, so maybe to get everyone else on board, I think, what was it, quality and access? Those are the two things.
Yeah.
So you got cost, quality, and access, and those are the three factors. And, if you want to have everyone have access and high quality, your costs are going to have to go up. So there's sort of a give-take relationship between quality and access. And those are the factors you look at for healthcare systems, just to clarify that. I think one of the things I'm pretty sure that Germany does is they do regulate drug prices. So the government will say, hey, you can't sell this this is the price you're gonna have to deliver this product at. That's it. So everyone's gonna pay this amount. I'm fairly sure about that. Still not certain though.
I'd read something online as well that they negotiate the prices of the drugs with the drug company.
Yeah.
Whereas in the United States, there's a law with Medicare, something with when Medicare was passed that they can't do that.
Yeah. So
they can't negotiate.
I think that would be one contributing factor. I just don't know enough about it to say, to be honest. That's a good question.
So would you think, just off the top of your head, from what you know, do you think the quality is comparable? Because you're paying a lot more in the United States.
Yeah. Yeah. Well, I haven't been treated, I've had a fair amount of experience here in Germany with healthcare system.
Right.
And in the United States, very little comparatively, because I was just a teenager, went to the doctor a couple times.
Probably never.
Yeah, basically never. But for the experience, I would say it's very comparable. Where the thing I would say though is I looked into some of the numbers at one point a long time in the past about. I think in the United States you have a lot of sort of if you've got a ton of money, you have the best procedures and the best surgeons. So you can kind of find this out if you look at the variance. So if you look at the not just average lifespan of the United States, but the variance in the lifespan. So that's how much so explaining variance would be like, say that you had this population. So some people are living 50 years and some people are living 100 years. And you just average all those out, you would get 75 years, right? But maybe you could get the same thing if some people were living 70 and some people were living 80. But those are completely different populations. Like if everyone lived between 70 and 80, that's much different than if everyone's living between 50 and 100. So the U.S. has, I'm pretty sure about this, a lot more variance than other countries. And what that can be an indicator of is having, in some places, very poor healthcare, and in some places are poor services, and in other, like, really good services that are amazing. Because some people are getting to live a very long time, some people are, not getting good access to health.
Yeah, that kind of leads me into another question, because in America, there's a lot of instances...
let me finish that real quick.
Okay.
So my thing would be, to answer your question, would kind of be like, well, that's what you'd want to look at, the variance.
Right. Okay. Yeah, so in America, like, a lot of the hospitals, like, you'll hear, don't go to this hospital, like, it's complete garbage. And you'll hear terrible stories from it. Send them to UAB, like where we're from. UAB is like the hospital for everything. Like if you get UAB, you're in good hands. Like those people are going to take care of you.
Yeah.
And there's a big variance right there where it's like, okay, if you go to this hospital, no, you want to get in this hospital.
Yeah.
But you can kind of choose that and go to different hospitals.
Yeah.
So in Germany, two-part question kind of, because is there much variance in between facilities? Like if you went to the number one hospital in Cologne and the worst hospital in Cologne, is there much of a difference there? And do you have options like that? Like if you found out that there was a really good person who treated what you have in Berlin, but you live in Cologne, and then you're just like, okay, I'm going to go to Berlin and seek treatment here. Is it easy to be able to move to those areas where it's better, and is there a lot of variance in between qualities?
Yeah, well, you definitely do have, because, you know, my wife, their family, they've got a lot of doctors in the family. So there are, on hospitals, you'll have all the different departments. And there'll be certain departments in each hospital that they're known for being really good. And then the other departments maybe just aren't known. So I don't know what the quality of those would be, but those would be places where it's like, oh, this isn't renowned. So the best doctors aren't, say, for the best what would be an example? Like heart doctors, right? There might be a researcher in the department of some hospital, say, in Cologne, and he's very well known for doing heart research and operations. So really good heart doctors want to go work for him, to learn from him, right? And so you'll have that variance, like really good departments in certain cities. So there is that. And there's also, in terms of like being able to go and pick where you want to, you have the right to a second opinion. So anytime a doctor gives you an opinion, you can always say, okay, and this was paid by the public option, I'm going to go get a second opinion from another doctor. So you can always do that.
Just once, or can you continue to do that? Like, could you go get 3 or 4 opinions?
You could, but then you're probably going to have to pay either your personal family doctor is going to have to say, okay, I think it's warranted. So let's say you go to a doctor. This is all under the presumption that you don't want to pay anything really, like nothing out of pocket. Because when I go to the doctor in Germany, you don't pay anything, right? So your family doctor would have to say, okay, I think it's warranted now that you've gotten a second opinion, and let's say they say the same thing, that you go see a third doctor. So if you don't want to pay anything, you would have to pay yourself if you did that.
But that second opinion's guaranteed, it's always free.
Yeah.
Okay.
You have the right to do that. Yeah.
Here's something that I have noticed about Germany as well, is that doctors get paid about $65,000 to $85,000 is like their median salary.
Yeah.
And in the United States, like it's very common for doctors. I believe the median salary for a doctor in the United States is like almost $300,000. And then if you're a specialized surgeon or some really high paid doctor, you can make $700,000. Like, does that create a downward pressure on demand for people to get into the field and become a doctor? And does that create shortages? And also the second part of that question, like, is that something that the market has determined is the median price for a doctor, or is this something that the government has come in and said, okay, no, the salary is going to be this for this field?
Yeah, the last option. So I'm not 100% sure what all the government organizations are involved, but there's a particular pricing, like salary based on years of experience, et cetera, when you're a doctor, that's what you get paid if you're in sort of the hospital system. Now, what a lot of doctors do, like if you're an eye doctor, they'll just open up their own practice. And then they can earn however much money they can get through their practice, right? So there's the public option, which is doctors in hospitals, all that kind of stuff. Then there's the doctors that go out on their own and open their private practices.
Now, the private practices are those, let's say you're on the public health insurance. Could you go to the private practice?
If they accept public. So most of them do. But some can say we only accept private. So like dermatologists.
Is there a benefit for them to only accept private?
Well, they can charge a lot more money. Because when they're doing public, it's all regulated how much they can charge for procedures. Like everything's regulated. So, for instance, I think if you go to a doctor, like if I go to my family doctor, now this might not all be correct, but I think the general idea is how it works. So if I go to my family doctor now for this quarter, they can say, okay, I'm going to write off this patient. He's visited me the first time this quarter. I get $100, whatever.
Okay.
And then the second time I go, they've already seen me, so they can't write it off. So they don't get anything for that second visit. So if you got a patient who's on the public option who comes to you a lot, you're not able to make money. Whereas if it's a private patient and they come to you all the time, you're able to charge them every time they come to you. Does that make sense?
Yeah. Okay. Okay, so you spent a lot of time in the hospital, obviously. Almost a month. You were living there. You're a resident. So
they all knew me.
Do you think your time there was spent efficiently? Like, do you think they were actually actively doing things to kind of what they should have been doing, or do you think, oh my gosh, this was so bloated that I could have been in and out of here in a week?
Yeah, well, I think first of all, it's important to note I would have been dead if they hadn't taken me out in the hospital because I had a collapsed lung, right?
Yeah.
So I'm alive now because of the healthcare system, right? And that we have. Secondly, I think I would say the time that was spent, it's hard to say whether or not it's spent efficiently because what you have is you have very few nurses, very few doctors, and a lot of patients.
Yeah. Sorry, before you get into this, so do you think the salary causes shortages with doctors?
Oh yeah, we didn't get to that. Okay, so the salary with doctors, I don't think that's the cause. Actually, there's very tight regulations in terms of how many doctors can open up a practice in an area, and there's very tight regulations on how many people are let into medical school. So the doctors themselves control how many new doctors can study medicine and become doctors.
But there is a shortage.
And that creates a shortage of doctors. Now, there's a second problem, I think. And again, this is all me just, not having studied this in detail at all, right? But the second problem is with the nurses. So now, at a family doctor, I've had nurses take my blood. In the hospital, I'm pretty sure nurses cannot take your blood. So there's very few things nurses can do in a hospital. And if you look at countries like Sweden, I was looking at this, I feel like there should be sort of a layered program, because if you think about a doctor, they have to go to school and study for 15 years, right? I mean, it's a ridiculously long amount of time before they finally become an actual doctor. And a nurse, that's a 2-year degree or something like that, or you just even go in for training out of high school and you can become a nurse. And I feel like they should have a layered option so that you can study a little bit more and then you can draw people's blood or you can prescribe medication or whatever for solve simple problems.
So you've got a shortage of doctors and then they're not able to have help even from nurses.
Exactly.
A lot of mundane tasks that should just be able to be done.
Exactly. And one of the big things is like protocol and writing and typing up reports and all this stuff. And so doctors are spending a lot of their time with that. And to me, that's something else that, that should just be whatever, some little 2-year degree, and then someone can do all that work for the doctors. Yeah.
Okay, so going back to the thing with the doctors opening up family practices. So what were you? What was that? I forgot now. You were answering a different question, and then we went back to the shortage of doctors. Like if they were.
So we're talking about how efficient it was. So I said, I'm alive because of it, and because there's very few doctors and a lot of patients. It's hard to say whether or not it's efficient because something might take a long time, but the doctor could be working all the time. Do you see what I'm saying?
Yeah.
So like one of the inefficiencies I think is that doctors have to do a lot of things that aren't medical related, and nurses can't do very much. That's kind of related to what we were just talking about.
Yeah, like you were saying, they have to type up everything that's going on. It's like the doctor has to be the one to type rather than just having somebody there take notes or something.
Exactly. Yeah.
Here's something I noticed when I was in the hospital is that when people would come in to see John and check him out or whatever, and this doctor walks in, he looks like he's a high school student. I was like, good gosh, this guy's the doctor? But a lot of them did seem young.
Well, that's because we were at a university clinic. So all of those are medical students that are in there. A lot of them are medical students that are studying medicine, and they have to do an internship.
And then, like, when something actually needs to be done with your case, the head doctor guy comes in, wizard.
Well, actually, the head doctors, so the official doctors, will only come in maybe once or twice a week, and they'll give you about 5 minutes, max. So, because they have no time.
But they're the ones making the final decision on your cases, or any of the major choices. It's not these.
Yeah, so what happens is the doctors get together and discuss in the morning all the cases. And they have sort of probably not the medical students. So the medical students have to do things like take blood and, just help out the doctors that are in. So in Germany, you have this 5-year period. It's called I'm trying to translate it, but it's basically your internship to become an actual doctor. And after you finish this internship, so you do your medical school, and then after you finish med school, you have to do your internship in a hospital. And then after those about 5 years, you can become an official doctor, and then you could open up your own practice somewhere. Okay? So in the university clinic, what happens is you have the doctors that are in their internship. So they've already finished their education, and they're not doing they're done with that. So they're in this internship to become an actual doctor. And usually those are the ones who are dealing with the patients every day. So they'll come visit you every day, and they'll be in charge of your case. And they report that in the mornings to the head doctors, the guys that have been there, 20 or 30 years. These are older doctors. And so that's where they discuss what needs to be done with the case. And so the older doctors, they don't visit you that much, but I'm assuming they help the younger doctors. They're like, hey, look at this, do this, we need to do this with this guy. And then the younger doctors have to go do all that.
Okay, cool.
Yeah.
So do you see any unique challenges to the German healthcare system that would not be there, like in an American system or something? Like, are they facing a situation where, it's all free to everyone, but now we have this massive immigration thing, now we have to fund these people, this is going to drive up costs, quality's going to go down. Like, are there any unique problems with the German system that you know of?
Actually, no, honestly. Now, there are some, but I don't know how you would make this better, but there's some sort of like a second tier system where probably your best surgeons, your best people are going to be private. So if you've got money, you're going to get access to the best people. Whereas if you're on the public option, not that you're not going to have good doctors and everything, but you're probably not going to get access to the, creme de la creme.
Yeah, but in all seriousness, there would be, there's a resource thing there too, where it's like, if there's only 3 doctors, even if they're available to the entire public, they're not going to serve everyone anyway, so.
Yeah, but I'm saying, like, a lot of times too, if you're on the private option, you'll be able to get like an earlier appointment and stuff like that, as opposed to if you're on the public option, that kind of thing.
But again, even if it's if it's 5 doctors who do this for the wealthy, if you were just like, no, you can't do that anymore, now you got to serve everyone, then there's still only 5 extra doctors serving the entire population of Germany, so they're still going to have to wait forever. It's not really going to change that.
I'm not making a moral argument.
Oh,
I'm just saying you experience that in the system. So that's something you would experience. You'd be like, if you're on the public option and you went in, someone on the private option who might have just gotten an appointment that day comes in maybe before you and they get called first. Something like that. You know what I'm saying?
So from your perspective, what are the biggest pros to the German healthcare system?
Well, first of all, I was in the hospital for 2.5 months, right? Basically. Just now. So imagine being in a U.S. hospital for 2.5 months. Your medical bills would be through the roof. You'd probably be bankrupt, especially for all the procedures they did for me. In Germany, if you're on the public option, you're paying $10 a day or €10 a day for your hospital stay. And that includes your meals and your bed, etc. And you don't pay for any of the procedures or anything. So Anna and I are not bankrupt. We don't have outrageous medical bills. We have medical bills, because I have to have, I've still got basically a drainage on my side to get the fluid out of my lung and stuff. And that costs a little bit of money, but it's something reasonable you can live with. We're talking max a couple $100 to $1,000.
Okay, so what are some of the biggest cons with the system, or with your time in the hospital, or any of that?
The biggest cons are, like I said, sort of the undermanned nature. So nurses, like I said, can't do very much. It's also a very demanding job. Like, I got to see that. So you got old people that can't move, that are very sick, that are, crapping on themselves. And maybe you've got 1 or 2 nurses and there's 60 people on a floor. And so they have to take care of them. And who wants to do that job? And they're not paid much money. So I think one of the cons is you're not... you're going to see the doctor for a couple minutes max. You're going to have to wait, so everything's going to take a long time, a pretty prolonged period of time. Like, I think if you had gone to a private clinic with what I had, and they were just focusing on you, what I had could have probably been analyzed in, a month. Because they still had to do a bunch of tests that took a couple weeks and stuff, but that time period could have been shortened. So I guess if I was having to say a con, it would probably be that. The fact that everything's just kind of prolongated, especially if you're not critical. Now, if you're critical, so when I went into the emergency room here, they looked at me and I couldn't breathe, And so they give you cards and they dial you up into whether or not you're critical or not critical. And so they got me and started like drain fluid in like, I want to say 15 minutes. Like it was really quick.
Right.
So it's also the same kind of thing in the hospital in general. So if any of the patients, so say you got 60 patients on a floor, if any of them become critical, well, they're getting taken off immediately. But that comes at a cost for other patients. Now it's going to take longer to take care of them.
Right. And I mean, you see that in the US too. I haven't been to the hospital in a long time, but the last time I was there, my face was cut open and bleeding profusely, and they took care of me pretty quick. But if you go to the ER and they don't see you as a you might be sitting for...
Yeah, if you got like a broke finger or something, you're going to be there. Yeah.
But I think that covers it pretty well. Thank you for coming. Glad you're out of the hospital.
Yeah.
Long road of recovery still ahead of him. But that's going to do it for this video on Germany's healthcare system. Thanks for talking with us. And we'll see you on the next one. God bless.
Oh, wait. I want to say something. This is all just my personal experience and opinion. And
you'll still get trolls, John.
I'm not studying that.
You're still going to come at you. Okay. All right. Thanks, guys. God bless. See you on the next one. I wonder if